The opioid epidemic is affecting thousands across Tennessee. So, Prompt Tennessee is helping communities find solutions, provide supports, and save lives. Our online training and customized resources help extension agents, health educators, and community partners better understand the opioid crisis and the epidemic of substance misuse. In Greene County, our partners are implementing Communities That Care, a community-driven process aimed at helping youth by strengthening bonds with family, school, and community. Strong bonds motivate youth to adopt healthy behaviors. This pilot will help other rural communities as Communities That Care expands. In addition, our researchers are identifying factors that increase substance misuse and abuse risk in Tennessee counties. We are developing new approaches to understand the epidemic's impact on the economy. Addressing this opioid crisis in Tennessee will take all of us working together. Join the University of Tennessee Extension, East Tennessee State University, and others to strengthen our communities. Visit us online to learn more.
Welcome, everyone. I'm Lisa Washburn, Associate Professor and Community Health Specialist with the University of Tennessee Extension. And this is the first in a series of monthly webinars addressing the opioid misuse issue in Tennessee. This series is part of a USDA-funded project, Preventing Opioid Misuse Through Partnerships and Training in Tennessee, or Prompt Tennessee for short. University of Tennessee Extension and East Tennessee State University's Addiction Science Center are partnering to bring you this first session series, Using Data for Action, What You Need to Know. I am pleased to introduce Angela Hageman, Director of Operations at the East Tennessee State University Addiction Science Center. Today, Angela will share a practical guide to understanding opioid data. Thank you, Angela, for sharing your knowledge with us.
Thank you, Lisa, for having me. Can everyone hear me okay? All right, great. And you can see the slides, correct?
Yes.
All right. I'm so excited to be with you all here today. And it looks like we have 47, now 49 participants. So thank you all so much for joining us. Again, like Lisa said, we're going to talk today in our first series a little bit about understanding data and why it's helpful in our work that we all do in the communities. Our learning objectives today are essentially to understand some basic opioid terminology. There are a lot of different terms to understand a little bit more about the incidence and prevalence of substance use disorder in our region and the nation, understand the impact that COVID-19 has had on persons with substance use disorder, know where you can find local data to make a difference in your community, and to understand how you can make a difference in the work that you're doing. And I will open by saying the work that you're already doing to educate young people to work in your communities, to help people maybe learn new career paths, are already making a difference. Anything that you are doing to make a positive, healthy community and climate prevents substance misuse. So you're already doing the work. And now we're just going to understand a little bit about some of the implications of substance use disorder in our communities. So before I dive into the data, I always want us to remember that every number, every data slide, behind those data are actual people, our friends, our family members, our mothers, our fathers. And in 2019, the state of Tennessee lost more than 2,000 people, 2,089 people to drug overdose. And Tennessee Overdose Prevention does a really nice job of helping to share their story and helping you learn a little bit more about these folks in our community. So I never want us to forget sort of that these data are about people. So here are a few commonly used opioid terms. Opioid can encompass a lot of different things. When we say opioid, we mean both natural, synthetic, and semi-synthetic chemicals that interact with our opioid receptors in our brain. This means opioid pain relievers like oxycodone, hydrocodone, morphine, and also synthetic opioids such as fentanyl, which can be prescribed legally and are also made illicitly on the illegal market. So opioids encompasses all of that. Benzodiazepines are sedatives, and they also can complicate symptoms of opioids. They can interact with opioids and lead to more dangerous implications for drug overdose. There are illicit drugs, and that is the non-medical use of both legal and illegal drugs. It can incorporate amphetamines, stimulants, cocaine, heroin. All of those are illicit drugs. Physical dependence is quite different from substance use disorder. So understanding that any of us can become physically dependent on a pain reliever or a drug after taking it for a number of days and may experience withdrawal symptoms when we stop taking it. That's quite different than meeting criteria for opioid use disorder or substance use disorder, which means a prolonged, usually over a 12-month pattern of problematic behavior. So there's a difference, and there's an opportunity to intervene prior to meeting the criteria for opioid use disorder. And then overdose, when we say overdose, there's both fatal and non-fatal, and we'll learn a little bit about some of the data when someone presents to an emergency department with an overdose, and then other data that is regarding fatal overdoses in our nation and region. So we'll start by taking a look at this slide, and we see our nation on the left-hand side in 2003. And during that time, very few counties in our country were experiencing overdose death rates higher than 30 per 100,000. Only a few of those dark red counties were experiencing those higher overdose death rates in 2003. And if you can see over on the right side, Appalachia was the only place with contiguous or counties that were touching that were experiencing these high rates of overdose death. So we knew in 2003 that we were already experiencing a problem. By 2016, you can see that this higher overdose death rates, these higher rates were happening across the country. And unfortunately, in many areas of our country since 2016, we would need a darker color purple because some are experiencing overdose death rates in the 40 and 50s per 100,000. So again, another slide that just shows this dramatic increase in drug overdoses since the 1980s and 90s. We knew back in the 90s that folks were suffering from substance use disorder, and some were experiencing fatal and non-fatal overdoses. But since the late 90s, we see just that dramatic uptick in total number of overdose deaths. So opioids are not new. The poppy plant was used as early as in colonial America. We had access to the poppy plant. In the Civil War, we were giving our injured soldiers morphine. So opioids have been around for a long time. And in the Civil War, folks they called it soldier's disease at that time, when folks became sick from withdrawal symptoms from the morphine they were receiving. But some very specific things happened in the 1980s and 90s that changed the trajectory of overdose deaths in our nation. It began with about a 2-paragraph letter to the New England Journal of Medicine that said opioids were probably not, they're probably safe to use, and that people probably would not become dependent or addicted on these medications. Now, keep in mind, those were not peer-reviewed studies. At the time, many of those doctors that reported that study were a very small number of patients, and they were some of whom were end-of-life cancer patients. So this was not really a peer-reviewed article. It was a simple statement that they weren't experiencing these problems. Well, our pharmaceutical companies at the time were coming up with some new formulations of pain relievers, and they were ready to market those pain relievers. And they took that 2 paragraphs and sort of ran with it, if you will, and began to aggressively market opioids to certain parts of our country. And then that is about the same time that we saw that dramatic uptick in overdose deaths. So along those lines, if we look here on the left, it is, we had recent access to a DEA database that showed us the total number of pills sent to certain areas of our country. So on the left is the number of pills per person sent to certain areas of the country from 2006 to 2012. Often dark red means an area where there's a high risk. So we see the darker red is where the highest number of pills were sent in our country during those 6 years. Again, we see Central Appalachia and Appalachia as a hot spot that received a number of pills, a very high number of opioid prescriptions. On the right, we see in blue those very same areas and the correlating overdose death rates during that same 6 years. So we see how much of a correlation there is between the total number of opioid pain relievers and prescriptions sent to certain parts of the country and the areas that suffered from the higher overdose death rates. So if we want to know a little bit more about in the nation, if we're thinking about opioid dispensing and the number of prescriptions or dispensing rate per 100 persons, the lighter yellow color is everywhere in our country in 2019 that had total dispensing under 100 prescriptions per person. So 64 or less per 100 in most of the nation. The orange and red states are areas with higher numbers of prescribing. And so in Tennessee, we are currently third in the nation. In past years, we were second in the nation for the highest number of opioid prescriptions per 100 people. So in 2019, we were at 74.6 per 100. We still have some work to do in that area. So the opioid epidemic, as we've come to know it in name, has had three waves, if you will. That first wave was related to prescription opioid overdose deaths. And we talked about that proliferation of opioid prescriptions. And we had a high number of deaths there. You can see the purple bar are those overdose death rates. And then when we began to realize that these prescriptions were causing a lot of problems and increasing overdoses, we began to put some controls in place. We made it more difficult to access opioid pain relievers. And some doctors would even turn away patients who were drug seeking because they just weren't quite sure what to do with them. And our treatment facilities were just not ready for the controls and the response that happened for folks that still had a dependence on these drugs and were now no longer able to get them. And so our cartels and other places knew about the demand and they provided the supply through heroin. And so you can see in 2010, our heroin-related overdose deaths began to increase. And then the third wave happened when other suppliers, if you will, were providing synthetic opioids, fentanyl and other synthetic opioids, many of which have come from China and other countries. They began to enter our drug supply, began to be mixed in our drugs that were available on the street, and were much stronger than what we'd seen in our opioid pain relievers and the heroin deaths. And so we see that black line as just another dramatic rise in opioid-related overdose. And what we're experiencing now, it hasn't technically been named the fourth wave, but we are seeing in the past 2 to 3 years a rise in psychostimulants, cocaine, methamphetamine, and we can see that the psychostimulant is a psychotropic substance with the capacities to stimulate the central nervous system. It includes prescribed ADHD medications, methamphetamine, cocaine, MDMA, also called ecstasy. So we're seeing a rise in those deaths. And from 2012 to 2018, the rate of overdose deaths involving cocaine tripled, and those with psychostimulants increased 5-fold. So we are seeing a dramatic increase in that as well. So as we hear all of this bad news, it is helpful to know that we can access data I forgot to say this earlier. Please, if you have any questions along the way, pop those in the chat box. I know I'm throwing a lot of information at you, and please feel free to throw any questions that you have in the chat box. We are monitoring that and we'll answer those at the end of the show. So I apologize for not saying that earlier. And also in the chat box, there will be a link to this database, which is the opioid overdose mapping tool for the Appalachian region. And it allows you to go in, take a look at counties that you might be working in, states in the Appalachian region, and add overlays that show local economy, ethnicity, educational attainments, and so that you can sort of see the correlation between overdose death rates and maybe some of these other factors that are in the communities that we live and work in. Michael Meat and his team at NORC created this overdose mapping tool. It's updated annually, and he is now working with us here at East Tennessee State University. So I hope you have fun sort of exploring that. And again, COVID-19 has impacted folks with substance use disorder. We're not exactly sure all of the factors, but some of the things that we in the field have been suspecting is that the isolation would cause folks who were in recovery perhaps to relapse if they couldn't access their regular meetings. Also, folks who are actively using tend to have a drug dealer, or, and that's a negative word, but that's what we know it as, someone that they access their drug of choice from, that they trust and that they know. And in the times of pandemic, they may not be able to have that more trusted source. So we expected to see a rise in overdose deaths and relapse during this time. And these are a number of articles that show that unfortunately that has been the case. The CDC released an advisory in December of 2020 that showed the number of states that were experiencing an increase in overdose. And the map that you see there is the 12 months ending in May of 2020, the 12 months prior to May 2020. And each state in red had an increase in overdoses during that time. And this recommendation, this report also includes a number of recommendations that can be used in local communities. So again, another look at pre and post-COVID. Our bars here on the left-hand side show that before the stay-at-home orders across the nation went into place, a number of counties were reporting overdoses, and those are the total numbers in the maroon bars. After many of the stay-at-home orders commenced in March, around March, we can see again the yellow bars show an increase. We also see increases during times when the stimulus checks went out. So some of our highest numbers of overdoses occurred in May, and again, a high number of them again in December of this year, or this past year. So again, an 18% increase in overdose deaths after stay-at-home orders. So if we look at our neighboring state of Virginia, this is a visual of the different regions of Virginia, and it compares the last 3 months of 2019 to the first 3 months of 2020, and it shows that all regions except one experienced an increase in admissions to the emergency department related to drug overdose deaths. So now I know that most of us live and work in Tennessee, and so we'll be sure to cover that Tennessee data more carefully. This is much like the Virginia data. It shows when folks appear at an emergency room for an overdose. And this is from November of 2020. And in the upper left-hand corner, you can see this report was put out in November of 2020. We can see that the blue line was overdose folks who went to an ED for an overdose. The blue line is 2019, the red line is 2020. Again, we can see the dramatic spike in May and overall a higher number of overdose and EDs in 2020. And on the right, it shows that the age group that was most affected during this time was the 25 to 34-year-old age range. And then at the bottom, we can see that the darker blue bars are heroin-related overdose admissions, and then the lighter blue-green is opioid excluding heroin. So again, heroin is a factor, but the opioids excluding heroin during this time frame were higher. So oftentimes what you'll be able to see, and I think Stephanie is also going to provide in the chat function a link to the Tennessee data dashboard. It's a great place to look at and understand sort of the implications of substance use disorder in our state. But it does often lag a year or two behind because by the time they collect all of the county level data and review it, there's a little bit of a lag. So this shows us the years 2014 to 2018, the total number of drug overdoses, both fatal and non-fatal, by drug type. So we see that opioids in all 5 years were the highest number, with the benzodiazepines, those sedatives, also playing a role, but going down in the past few years, and that increase in the stimulant involvement in overdose deaths, fatal and non-fatal overdoses. And this gives you a little bit more of a look at your county where you may live and work. And this shows the increase or the rate of change in a 1 year time between 2017 and 2018 in the opioid related overdose deaths. So you can see the higher number of counties had an increase, those darker red and oranges. Some counties did have a decrease during that 1 year period. Unfortunately, that looks a little different in 2019 and 2020, but this just gives you a little overview of county level data that's available to you. And then again, stimulant related overdoses. So the percent change, the increase, you can see most counties did increase. Overdose deaths were more related to stimulants. There's an increase in stimulant involved overdose deaths during that 1 year period from 2017 to 2018. So this is layering on the previous two. We have additional 2019 data. It doesn't look exactly the same, but we can see in the upper right-hand corner that all drug overdoses were that 2,089 number that we looked at in our very first slide. And this is a picture that allows you to see the different drug types and the increase, as you can see, in fentanyl and opioid deaths from 2018 to 2019. And again, another look at the stimulant overdose. So again, in that added year from 2018 to 2019, we're still seeing that increase in stimulant-related overdose deaths. So I know that that was a very quick overview of the different types of data that are available to you, but you will have access to these links so that you can dig in more closely and examine what's happening in your communities. Each of these data resources are hyperlinked to the data dashboard that was put into the chat. Also, there is the Smart Tennessee, the UT I can't remember what the acronym stands for, but there's a group at UT, the Smart Policy Initiative, I believe, and they have excellent county level data there as well. The overdose mapping tool that you saw in an earlier slide. Also, number 4 is a list of all of the treatment agencies available in our state by county level. And number 5 is different anti-drug coalition contacts. And it's also in this next slide. So if you don't already know, there are groups, most counties in our state are funded to have an anti-drug coalition, and that coalition does a lot of primary prevention work. Many of you health educators may also already be working with anti-drug coalitions, but it's a great way to get a better understanding of how we can work together to make safe and healthy communities. Even if we're not experts in opioid data or clinicians who provide treatment, there's so much that we can all do and that we're already doing to make safe and healthy communities. So my only recommendation would be to maybe get more involved and know more about what work your anti-drug coalition is doing in your community. All right, so I am happy to entertain any questions that folks might have.
We don't have any questions in the Q&A or chat just yet. Folks may still be digesting some of the data or the information that you shared.
Certainly.
While they're thinking, can you talk about the difference between the drug overdose deaths and just drug overdoses, people going to the hospital? Because that's something that gets me confused a little bit of the time.
Yes, absolutely. So an overdose is sort of a poisoning by the chemicals that are in our body. And so sometimes folks experience an overdose depending on the drug. The overdose symptoms may be different. But if you are presenting with an overdose, you may have rapid breathing, you may have very slowed breathing, and oftentimes if someone has access to, say, Narcan for opioid overdose, you can actually revive the person. And so Narcan can be very helpful in that. So an overdose is any time that you're having a drug poisoning that has sort of threatening symptoms. And a fatal overdose is when someone unfortunately succumbs to these symptoms of the drug and that their body is no longer able to continue breathing and staying alive. So I do think that there's just a difference. Folks can overdose, in a number of symptoms, present at the ED and have an opportunity for an intervention and be revived and saved from that.
So we have a question in the chat. Is the county that they live in or the county that they died in the one that's documented? So if they live in a small county, but they go to a larger city hospital and that where they passed or where the overdose is recorded?
That's a great question. I do believe that the ICD-10 codes that I showed for Tennessee are the county where they present to the ED. But the data that goes to Tennessee that, again, I said lags behind a year or so, they are able to demonstrate the place where the person resided in. And so the data, depending on the snapshot and when you look at it, it can be different.
Okay. Another question is, why do you think Tennessee continues to be in the top 3 in the nation for prescribing opioids?
Yeah, I mean, I would hesitate to sort of, I don't know exactly. I do think that we're doing better with that. I do think that, part of it does have to do with pharmaceutical company marketing. We do see that Central Appalachia, that little area on the map that is still prescribing very highly, was also targeted very strongly by pharmaceutical industries. And so there was a lot of training that took place at the time that encouraged doctors to use these opioid pain relievers. I think it's an excellent question, but it is interesting that we see that all of those states are clustered together. So it's, we're not in this alone.
Yeah. Another question is about rural Tennessee hospital closings and the relationship between that and fatal overdoses. So has there been an increase in deaths because of rural hospital closings?
Wow, that is such a good question. And I honestly, one might assume that if someone is experiencing an overdose and there is not a hospital that is very close to them, one could certainly guess that that may have an impact. I do not have access to data that proves that, so I couldn't say for sure. But I do know that, it is quite important for all of us to have access to Narcan. We have this very high rate of opioid access. We have a high rate of overdose deaths, and we want to be sure that folks have access to Narcan, especially because many of these overdose deaths relate to opioids, and that can, be a lifesaver when someone is far from a hospital. Unfortunately, is not effective for the stimulants that are now in the fourth wave, and so. Yeah, it is a very difficult discussion to talk about these rural hospital closures. So thank you for that question.
Okay, we had a question in the Q&A, and the attendee asked, who has this opioid overdose injection? Does law enforcement have it, ambulance providers, rehab facilities?
Oh, the Narcan, the
Yes.
Narcan.
Can you talk a little bit about the Narcan and the different ways it's available?
Absolutely. So Narcan is the brand name for naloxone. Naloxone is an opioid antidote. It is typically sprayed in the nasal cavity, and it is not harmful for someone who is not experiencing an opioid overdose. If we were to, if I were to demonstrate it right now and I didn't have opioids in my system, it is not harmful to me, but it does kick off the opioids on the brain's receptors. So that depressed breathing and the symptoms that cause overdose and ultimately death can immediately be stopped by the administration of Narcan. Narcan is available in most pharmacies without a prescription. It is covered by most insurance plans. It is also available for free from many of our anti-drug coalitions. There are a number of ROPES, they're called, regional overdose prevention specialists across the state that have access to it. So I can, if I know what county someone's from, I can direct you to the ROPE that can provide the training and free access to Narcan. But again, most anyone can walk into any pharmacy and request it or get a prescription from your doctor. It is covered by health plans. And I think cash money, if your health plan doesn't have it and you just had to buy it outright, it's about $80 a dose.
So we have a comment from Kimberly. She's with one of the county prevention coalitions and has said that she'd love to work with anyone in her community. And I would imagine that's true, Kimberly, for the others who serve in similar roles. One of our hopes with this webinar series is to help connect people who are doing work around this issue, because we have a common goal to help our communities, and it will take all of us working together.
Yes, and I would say that we don't have to be experts in any of this to make a difference. I mean, I think that's what this group, as we've created this webinar series, have really learned that everything that we're doing to sort of reach out to one another during this difficult time and create safe and healthy communities and impact our young people in a positive way is making a difference.
I don't see any other questions in the chat or Q&A, and we're coming up on the end of our time. So thank you so much, Angela, for being here today and for sharing your knowledge with us. And thanks to the team from ETSU and UT Extension who's helping to produce the webinar. They're working behind the scenes. And thank you all for joining us today. We hope that you will attend upcoming webinars in our 3-part series. So we've got 2 left. One is Unpacking Tennessee Adolescent Substance Misuse Data, and the other is A Guide to Addressing Substance Misuse in Your Community. You can register for those webinars on our website, prompt.tennessee.edu, and that is also where you'll find session recordings and resources. Thank you for joining us today.